All right, I've been getting a bunch of questions on the 229 Healthcare Certified Sales Professional Program, and I wanted to put together a video to answer those questions, probably put it out on LinkedIn and some other places. Let me give you an idea of what's going on here. First of all, my name is Bill Russell, former CIO for a 16 hospital system and founder of This Week Health, also the founder of the 229 Project. 229 Project, quite simply, is a community of people. We 229 stands for February 29th, 2020, first reported death of COVID to the CDC. Around that time, a lot of interesting things happened in the industry, but one of the things that happened was people started calling me to find out what was going on at other health systems. And I found that odd, and I felt the need to step into that gap and identify a way for leaders to have stronger relationships and community for when the next pandemic hit. And so we formed the 229 Project. We generally do small group meetings, about 10 to 15 people. There's not a lot of agenda. It's just facilitating conversation amongst them and developing the relationships so that in the event of the next pandemic, people will be tightly connected and be able to reach out to one another. So that's where the 229 Project came into existence, February 29th, 2020. Also, when we started This Week Health a long time ago, it was obvious to me that we had a problem, and the problem was the relationship dynamic between healthcare leaders and sales professionals. And my first experience was a HIMSS meeting in Vegas, I believe it was, of all places. And I liken it to the Hunger Games because they gave me a badge. I had CIO underneath. I went into the floor, the showroom floor, and was just besieged by you name it, people capturing my information, filling my inbox, you name it. It happened exactly how you think it happened because it still happens to this day. And I thought this is a bad environment to which to try to start a relationship on trying to identify and solve the hardest problems that we are facing in healthcare. You need to know that healthcare CIOs are fairly overwhelmed just in general. The amount of challenges and problems that are sitting on their plate are pretty significant, and the resources are being squeezed, the requirements are being increased, and so they're generally I would say stressed to begin with, and then you throw on it the number of people who are trying to get in front of them to convince them that they have the greatest thing since sliced bread, and so that dynamic is very difficult. The sales professionals, my heart goes out to you. I personally have been a part of selling close to $40 million worth of services and products into healthcare over the years. And it never ceases to amaze me that each one's a little different. The amount of time it takes to get a contract done, the changing dynamics within the organization. They tell you you have the sale, then you don't, then you have to meet with another group. And I mean, you've all experienced these kinds of things. And what we wanted to do is we wanted to step into this void. First of all, we wanted to create a better dynamic between sales professionals and healthcare leaders. And we met with a bunch of healthcare leaders to say, are you on board with us stepping into this? And they said, absolutely, go for it. We will support you any way we can. We went with a bunch of sales professionals and said, is this truly a challenge and a problem for you? They said, absolutely, step into it. So we've decided to wade into it. How we've uh, how we've decided to wade into it was we at the 229 Project in This Week Health, we have three former CIOs on staff. Myself, Drexta Ford, former CIO for multiple health systems, and Sarah Richardson, former CIO for multiple organizations as well. We do extensive work with healthcare leaders today. We will do close to 60 events this year, small events. We don't do the large carnivals. We do more the intimate setting kind of events. We'll do about 60 of those in the form of city tour dinners and summits. And in that, we stay very connected to the community. We understand what's going on, what they're looking for, what their challenges are. And we've also built a significant amount of trust within the industry, both in what we have done prior to the work that we're doing today with the 229 project and This Week Health as CIOs and peers of this community, but also the work that we are doing today to help to bring them together as a community and help them to identify solutions and whatnot. So we decided to wade into this, and we really tried to start with a clean slate. We thought, how do we do this? One is we can't just step into this and step out. We can't just throw something in there and say, hey, here's this magic thing. If you guys do this, everything will be fixed. We know that that's not the case. It's a pretty complex problem. You have to get really involved, and so we want to insert ourselves into this to be a honest broker, if you will, between two parties, and not from a transaction standpoint, but from a brokering a better environment from which to have discussions and conversations. And so the first thing we wanted to do is we wanted to pull back the curtain a little bit for healthcare sales professionals, and we wanted to share what we know, what we've learned both in selling into healthcare and what we've learned from being on the other side. It's a unique perspective. I personally had a $250 million a year budget, and that's the amount of stuff I was buying every year. But I've also been on the other side of the table, sitting across from that CIO who I had to figure out a way to position what I was doing in a way that they could see the value that it was going to bring to their organization. So I've been on both sides. And I thought, okay, we can create some content. So Sarah Drex and I went into a studio in November of last year, and we recorded close to a little over 5.5 hours of content around just pulling back the curtain, what we know and what we've experienced, and what leads to success. So that's I share a little bit about what I've done with regard to that, and so I have a bunch of lessons just around selling into healthcare, key principles from a CIO's perspective, real world strategies that work. Drex, with his work at CrowdStrike and being a CIO, he developed a series around building the client profile. So understanding healthcare's complexity, understanding what you're selling into, and navigating the decision making that goes on within healthcare and understanding what's going on. And then Sarah had this great idea, and it really is fantastic. She wanted to get direct insights from both sides. And so we identified 5 sitting CIOs that you'll know when you see them. And she asked them each the same questions about working with partners, what they're looking for, what works, what doesn't work, how they like to engage with partners, what's the difference between a vendor and a partner, and those kinds of things. So she had 5 CIOs, and then she identified 6 sales professionals who have been successful over a long period of time selling into healthcare, and she interviewed them with the same format, collecting that kind of information and putting those into videos. All of that comes together in about 5.5 hours of content. Now we're going to keep adding that content, but that is the core content for the HCSP certification. We then asked ourselves, what does it look like for us to certify somebody? A 229 HCSP, what does that mean? And one of the things we understand is that you're borrowing our trust. We have a certain amount of trust that we've built up within the industry, and we're going to give that to you. But first, what we need from you is we want to know that you understand this material. And in a lot of cases, what people do from an efficiency standpoint is they just stand up a test and you take the test. And if you get a 80% or higher, you win. You get your certification. We didn't want to do that. What we decided is we're going to interview everybody who wants the certification. And so the certification really is 3 steps. The first is that you will submit a client reference, and we will talk to that reference about what it's like to work with you. The second is you will prepare a case study. Now, the case study is going to be your stuff, right? We're going to act as the CIO of a health system, and we'll give you that profile, and we'll try to match one of the profiles that you're currently calling on. And then you take the stuff that you're currently selling, whatever it happens to be, could be services, could be staffing, could be whatever it happens to be, and you're going to build that out. You're going to build out a presentation to us, and we're going to have like you have a 20-minute window to talk to the CIO, and we're just going to go back and forth, and we're going to provide you feedback on your approach, on some of the things that we recognized in that process. And then we're going to talk a little bit about the material that you watched. And so you're going to demonstrate that you learned the material. We're going to talk about the material, and we're going to talk to one of your clients about what it's like to work with you. What I'm going to do now is I'm going to share my screen and share the two things, really. The first is, got to figure out how to use technology. There we go. Share. The first is where you can go to get more information about the program. So this is the new 229project.com website. You can go here and you can see get certified is right here. There's a 30-day money back guarantee on this. So if you're like, hey, I want to try this out, but I'm not sure about it, you can go right there. Here's a little bit about our bios and who we are. There's a path to certification. We have actually two levels within the program, and you can get more information again on the 229project.com website. First is you can just become a member. Now, when you become a member, we had significant conversations over whether you get access to the videos or not with a membership, and we decided yes, you get access to the videos. So for $39 a month membership, you get access to the community, and I'll show you the community in a minute. You get certification materials. So you get access to the courses, and you'll be able to see the courses. And then we will be creating exclusive 229 community content. So this will only be available to our members moving forward. If you decide, hey, I want to get certified, that cost is $69 a month for while you are actively pursuing your certification. Once you get certified, that drops down to $49 a month. All right, so you get community access, you get certification materials and courses, you get exclusive 229 community content. But in addition to that, you also get a quarterly market session. As I said, we do 60 meetings a year with healthcare leaders. We hear a lot of what's on their mind, what are they focused on, and just those kinds of things. We're going to do quarterly market sessions, our Zoom meeting for that community. We will, Drex, Sarah, and I will prepare like a 30-minute presentation on what we're hearing and what's going on. The rest of it, the other 30 minutes, is going to be you guys asking questions. And you could ask us specifically about what's going on in your, you could be in maybe cybersecurity. You want to ask some questions about that, and we'll answer those. You could ask, I don't know, whatever you want to ask. That's what it's set up for. But this is for our certification members. The certification process, if you want to get 229 designated 229 HCSP, you have to go through this path. We have monthly office hours. Those are 30-minute meetings once a month with myself, Drex, and Sarah. Well, at least one of us, if not two or three of us at certain times, will be taking those monthly office hours. And then obviously, we've already talked about once you get certified, it drops down to $49 a month. To maintain your certification, by the way, we will recertify every 3 years. To maintain your certification, you have to maintain your membership, and mostly because we're creating a community that we think will help you to be successful. So the first thing I want to show you is this community. You'll get access to this once you sign up for the program. We have an industry feed. We're going to put stuff out on here. I'm putting videos already on this and some posts that it's just like any other feed that's out there. We're also putting our This Week Health stuff out here that we believe to be relevant to you in the industry. We have some things around the Yellow Hat Club and some pictures around that, and the 229 story. That's the general community. If you become a 229 project member, you'll have access to that community. And as well as this HCSP courses. So again, here's selling into healthcare, know your client, play the long game, cultivate referrals, some of the things that we cover, building the client profile. This is Drex talking about the different types of health systems, champions, buyers, influencers, internal competition for the deal. You get the picture. And then here's some of the CIOs we've talked to and some of the sales professionals that we talked to along the way. You get this with the membership. Now, if you decide you want to get HCSP certified, You get to be a part of the HCSP discussion. You get to be a part of office hours. There's actually a directory of people that are a part of the HCSP program, and this goes on and on because we opened the program a couple days ago, and then the quarterly market session. You'll also have access to that here as well. So that's the stop sharing that. And so that's an overview of the community and the program. If you're interested, again, there's 30-day money back guarantee. You can join the community. You can join at the $39 level. You can join at the $69 level if you want to get certified. You complete the certification, you complete the training modules, you schedule your certification interview, you earn your certification. We will give you a badge associated with that. And then every year after that, so we have a certification badge for year one. If you maintain your certification for year two, you have a year two badge, year three, year four, year five. And we will have, hopefully, we'll have people with HCSP certified for 10 years or so in the future. So we'll see where that goes. So this is a limited time registration window. Let me tell you what we're doing. This is a soft launch. It's going to be open for a week and a half. I think the 19th is Wednesday. It's the last day of Vive. And we are going to close down the program for, not close down the program, we're going to close down registration for a period of time. We're going to have the people that are in the community who are providing feedback to us, and we could potentially change some things when we reopen it. But we wanted to get a cohort in here and working with us on what it looks like, get some experience on what it could mean and what could make it better as a community. We want to continue to get feedback. We'll open it up again probably sometime in April. But for now, there's going to be a limited registration window, and you can join now and hopefully get a jump on the certification as opposed to waiting till April for us to reopen it again. We're also going to release some new training in April that's already been recorded. We already went into the studio and did that. So anyway, that's pretty much the overview of the Healthcare Certified Sales Professional program. What we want to do is we want to help you to become a trusted partner to healthcare leaders. We want to help shorten sales cycles. We want you to experience what it is to build long-lasting relationships between solution partners and healthcare leaders. And we also want to create an elite group of certified professionals that are recognized in the industry. And we're going to support that. We're going to shout it from the mountaintops that every CIO should look for a 229 HCSP professional. It's going to be somebody who understands relationship selling. It's somebody who plays the long game. It's somebody who values being a partner, who's not looking to be part of the Hunger Games and the transactional nature that has really made this a very difficult environment, but somebody who wants to be part of the solution. So those are, that's the program in a nutshell. We want to change that dynamic, and we would love for you to be a part of it. So if you get a chance, go ahead and check it out, 229project.com. You can head over there and get signed up today, and definitely do it before next Wednesday, because that is the last day you'll be able to sign up before sometime in April. We haven't even decided on the date yet. So that's all for now.